Hi, I'm Jesse Dickens. I'm an orthopedic surgeon here at Midland Memorial Hospital. I've been in the area for 4 years now. My area of expertise in orthopedics is sports medicine as well as joint reconstruction. What's great about my job is that I get to fix people. After surgery, people go home and they recover, they get better, and they're able to do the things they used to do before their injuries. I've been an orthopedic surgeon for approximately 10 years, and growing up I've had many sports injuries, and so that's what's got me into orthopedic surgery. In comparison to the traditional way of doing a knee replacement, using the robot-assisted technology, we don't require as many assistants around the patient. I think that lowers our risk of infection as well. The number of trays that are needed to open in order to do the surgery traditionally has 6 or 7 trays versus 2 with the robotic assisted method. I think being able to plan this on the computer before any cuts are made to the patient is amazing. It's really changed the way I've thought about how the knee's done, and the ability to rotate and move the implant or the knee replacement in space has really changed the way I feel like we're going to do knee replacements. Currently, about 20% of the U.S. has robotic technology in the OR, and I think that number is going to be increasing as more and more surgeons discover the benefits of this. During surgery using the robotic assisted technology, what happens is the patient goes to sleep or has a spinal just like our usual traditional methods, except we have the robotic console next to the bed as well as cameras in the room. And what happens is you have to place markers on the patient's legs, which is seen by the cameras, and that technology is computed back to the computer in conjunction with the 3D CT scans that we had done prior to the surgery. So during the surgery, the robotic arm and the computer tracks the patient's leg in space. The cuts that are made with the robotic assisted arm under the control of the surgeon. This allows the cuts to be very, very precise in a manner that avoids damage to soft tissues around the knee. At Midland Memorial, we try to prevent any kind of infection through the joints. I think if you look back through the numbers, the risk of infection in Midland at the hospital is much, much lower than the national average. Part of the way we do that is the steps we take in the OR to prevent the number of people in the OR, to prevent traffic that comes in and out of the room, as well as the sterilization procedures we follow, and then the actual time to do the surgery. All these are factors that we watch and we monitor very closely, and I can say to date we've had no problems here, and I've been very pleased with the results my patients have received. So if someone's complaining of knee or hip pain, they can discuss this with their primary care physician and get referred to West Texas Orthopedics, or if they'd like, they can just call our office, West Texas Orthopedics, and make an appointment.